Hello everyone, welcome back to my YouTube channel. Today we'll study about the antitussives. Okay, antitussives means against. Anti is the thing but an against. The tussives is an cough. Okay, antitussives. These drugs are used to suppress the cough, are used to treat the cough, especially for the non-productive coughs. Means antitussive agents are used to treat the non-productive coughs. Okay, here the classification of antitussives are opioids, non-opioids, antihistamines, and adjuvant antitussives are bronchodilators. Opioids are example for opioids: codeine, ethylmorphine, and folcodeine. Codeine, ethylmorphine, and folcodeine. Example for non-opioids are noscafin, dextromethorphan, and clofidinol. And next example for the antihistamines. Example for antihistamines are chlorpheniramine, diphenhydramine, and promethazine. Chlorpheniramine is also called as a CPM, chlorophenyramic maleate. And next, adjuvant antitussives and bronchodilators are salbutamol and terbutaline. Okay, these are the examples for the antitussives. And next we'll see about the mechanism of action of the antitussives. Here they act on central nervous system. Because they act on the central nervous system, then it leads to increase the threshold of cough center and reduce the impulse generation for cough stimulus in the respiratory tract. Okay, increase the threshold of cough center andre threshold cough center ಮೇಲೆ ಏನು ಮಾಡುತ್ತೆ threshold ನ increase ಮಾಡಿಬಿಟ್ಟು reduce the impulse generation. Okay, ಅಂದ್ರೆ ಕಪ್ ಸ್ಟಿಮ್ಯುಲೇಷನ್ ಸೆಂಟರ್ ಏನಿರುತ್ತೆ ಅಲ್ಲಿ ಇಂಪಲ್ಸಸ್ ನ ಜನರೇಟ್ ಮಾಡುತ್ತೆ. So these are all present in the respiratory tract. Okay, the impulses are the stimulus of the cough centers, those are present in the respiratory tract. Then it leads to these drugs are indicative only, means these drugs are only administered for the non-productive cough. Okay, means expectorant and the thick mucus collections iruvanta cough ge even the antitussives na administer madala. Only these drugs are administered for the dry coughs. Okay, these are the classifications with examples and a mechanism of action of antitussives. Next we'll see the in detail explanation about these classifications. Next we'll see about the opioid antitussives. Okay, here the opioid antitussives have the central mechanism of action on the opioid receptors in the medullary cough centers, and they may have additional peripheral action on cough receptors in the proximal airways. Okay, mainly these are affecting on the medullary cough centers. So here the example for the opioid antitussives are codeine and folcodeine. And codeine, so here the dose, age group, and dose and route of administration of this codeine is for the adults 15 to 16 mg every 4 to 6 hours. ಅಂದ್ರೆ every 4 to 6 hours ಏನು ಮಾಡಬೇಕು 15 to 60 mg ನ ಅಡ್ಮಿನಿಸ್ಟರ್ ಮಾಡಬೇಕು. ನೆಕ್ಸ್ಟ್ ಫಾರ್ adolescents 12 to 18 years, 12 to 18 years 7.5 to 30 mg every 4 to 6 hours. And for the children 2.5 mg to 5 mg every 4 to 6 hours. This is the age and dosage of codeine. And next we'll see about the folcodeine. The age group and dosage of this folcodeine is for adults it should be administered 10 to 20 mg for 4 to 6 hours. Okay, it should not exceed more than 120 mg in 24 hours, and 20 into 6, that is 120 mg. It should not exceed more than 120 mg in 24 hours, and 24 hours ಅಲ್ಲಿ 120 mg ಅಂದ್ರೆ ಕ್ರಾಸ್ ಆಗೋಗಿಲ್ಲ. If it is crossed, it may leads to the toxicity as poisonous, means the drug is going to release the toxins in the body. And next for the for children 6 to 12 years it is administered 5 to 10 mg per 4 to 6 hours. That should not exceed more than 60 mg within 24 hours. And next for children 2 to 5 years 2.5 mg to 5 mg every 4 to 6 hours. It should not exceed more than 30 mg within 24 hours. If the drugs are exceeds more than the normal, it may lead to the toxicity at the poisons in the body. Okay, so next we'll see about the indications. These drugs are used for the treatment of the dye cup, that is non-productive cups. Okay, non-productive cups ಆಗಿರುತ್ತೆ ಆ ಒಂದು ಟ್ರೀಟ್ಮೆಂಟ್ಗೆ antitussives ನ ಯೂಸ್ ಮಾಡ್ತಾರೆ. Okay, and next is the side effects. Usually the patient may having the headache, nausea, vomiting, and blurred vision, and sometimes he may feel the GI disturbances and diarrhea also. Sometimes the patient may feel the sleepiness. Okay, these are the common side effect of an opioids. Opioid antitussives. Okay, and the next mechanism of action means these drugs are absorbing through the orally, means these drugs are partially absorbed through the orally, and the distribution it occurs through the blood and other mucous secretions, and metabolism of action it mainly occurs in the liver, and the excretion it occurs through the excretion it occurs in the kidney, means the excretion it occurs through the urine. Okay, this is a pharmacokinetic of opioids. Next we'll see about the non-opioid antitussives. Okay, non-opioid. So here these are the agents used in reducing the cough without causing hallucination or narcotic action. Okay, opioid drugs are always causing the hallucinations and narcotic action, but the non-opioids, these are not causing the hallucinations and narcotic actions in the patients. Okay, here the example for the non-opioid antitussives are noscapine, dextromethorphan, and chlorpheniramine, and phenoxydizine. Okay, phenoxydizine. So first we'll see about the noscapine. Noscapine, here the age group and then dosage, age and dose. So here this drug administered for the adults is 15 to 30 mg every 4 to 6 hours as needed. Okay, ಯಾವ ತರ ಬೇಕೋ ಅದರ as needed, ಮತ್ತೆ ಬೇಕಾದ್ರೆ ಮತ್ತೆ ಯೂಸ್ ಮಾಡಬಹುದು. So 15 to 30 mg every 4 to 6 hours ಯೂಸ್ ಮಾಡಬೇಕು. Next for the children 6 to 12 years it is administered 7.5 to 15 mg every 4 to 6 hours. And next for the children 2 to 6 years it is administered 3 to 7.5 mg every 4 to 6 years. For the children below 2 years it is administered according to the pediatrician advice. Okay, according to pediatrician advice and as per the guidance of the depend upon the patient age and weight of the babies. So next we'll see the dextromethorphan. Dextromethorphan, the dose for the adult is 10 to 20 mg. For children 2 to 6 for the children 2 to 6 years of children is 2.5 to 5 mg, and 6 to 12 years children is 5 to 10 mg. So next for another one dose is and chlorpheniramine. Chlorpheniramine it is administered 20 to 40 mg. And next phenoxydizine it is administered 100 to 200 mg 3 times in a day. Okay, these are the examples for the non-opioid antitussives. Here the indications means in which conditions we should administer these non-opioids. Those are for the non-productive cups. And contraindications means these drugs in which conditions we should not administer the non-opioid antitussives. Those are the patient who are having the hypersensitivity reactions, and for the pregnant and the children without the prior intimation of the gynecologist as well as the pediatrician we should not administer the drugs, and the patient who are having the severe asthmatic condition, these are more contraindicated. Okay, and the next mechanism of action of these drugs are mechanism of action and the pharmacokinetic of these actions are these drugs are absorbed through the oral secretions and distribution. These drugs are distributed through the mucous secretions and as well as the blood through the body, and metabolism is mainly occurs in the liver, and excretion it occurs through the kidneys. Okay, this is the pharmacokinetic of these drugs. And the side effect, usually the side effects are more common for all the drugs. Those are nausea, vomiting, headache, and the patient may feel slurred speech. Okay, slurred speech, and sometimes the patient may having the blurred vision and palpitations and GI discomfort. So these are the common side effects of non-opioid antitussives. Next we'll see about the bronchoconstrictors and antihistamines. Okay, bronchoconstrictors. Constriction is nothing but narrowing of the bronchioles. Okay, these drugs are used for the narrowing of the bronchioles. Okay, those are bronchoconstriction. Example for this bronchoconstrictors are methacholine and acetylcholine. This is also called as a choline. Okay, mechanism of action of this methacholine is a non-selective muscarine receptor agonist that act directly on the airway smooth muscle receptors. Okay, methacholine is a non-selective muscarine receptor agonist that act directly on airways. The non-selective muscarine is going to directly act on the airways and the smooth muscles. If they act on the smooth muscles, obviously there may be an increase of the bronchoconstrictions, means narrowing of the bronchioles. Next we'll see about the dose and the route of administrations. So methacholine and acetylcholine, these are available in the form of ready to use inhalation solution. Okay, ready to use andre ready ಮಾಡಿರುವಂತ ಒಂದು inhalation solutions ಅಲ್ಲಿ ಸಿಗುತ್ತೆ. Next, each strength contains a 3 ml per vial. Andre it is available in the form of vial that contains the 3 ml. Okay, one vial 3 ml vial one ಸಿಗುತ್ತೆ. So here next we'll see about the pharmacokinetics. Pharmacokinetics is nothing but what the body does to the drug. Here, rapidly metabolize after inhalations, means it is present in the form of the inhaler. So once you inhale, it is going to rapidly metabolize. Okay, metabolizations occurs, then it leads to wide distribution including the central nervous system, distributed through to the CNS also. Then it leads to metabolize in the liver. Okay, wide distribution at it is going to metabolize in the liver. Once the metabolization occurs, the drug should eliminate. It is eliminated through the urine. Okay, excretion, it mainly occurs in the kidneys. From the kidneys, it is eliminated through the urine. This is the mechanism of action of the methacholine and acetylcholine. So next we'll see about the side effects. Okay, after the administration, side effect or an adverse effect are the cough. Because of the excessive or the severe bronchoconstriction may leads to the cough, means the patient may feel the cough, difficulty in breathing and noisy breathing because of the severe constrictions. And if you are using the bronchoconstrictions in excessive form, it may leads to the severe bronchoconstrictions. Okay, prolonged period of excessive use of the bronchoconstriction may cause the severe bronchoconstrictions. Next we'll see about the antihistamines. Okay, antihistamines, these are a class of medications used to treat allergic reaction and allergic symptoms by blocking the effect of histamine. Okay, here anti is nothing but an against and histamines. The function of histamines, these are the chemical mediators which releases or which makes an allergic reactions in the body. Okay, these antihistamines, these drugs are going to reduce the allergic reactions in the body. Those are antihistamines. Okay, here these are the class of medications used to treat the allergic reactions and allergic symptoms by blocking the effect of histamines. Once the effect of the histamine is blocked, the allergic symptoms as well as the allergic reactions are going to reduce. Okay, next we'll see the classification of these antihistamines. Here the antihistamines are divided into 3 classes. Here the first generation antihistamines, second and third generation antihistamines. The first generation antihistamines are diphenhydramine, chlorpheniramine and promethazine. And second generation antihistamines are cetirizine, loratadine, fexofenamide and desloratadine. And next, the third generation antihistamines are leocetirizine and bilastine. Next, we'll see the indications, means in which conditions we should administer these drugs. Okay, those are specially for the first generation. Indication of first generation antihistamines. Here, the diphenhydramine. Diphenhydramine, it is used in the treatment of insomnia. Insomnia is nothing but a lack of sleep. Okay, because it is produces the sedative effect, it may leads to the sleeping. And motion sickness. Motion sickness is nothing but while traveling, the individuals may feel the vomiting sensation, nausea and the vomiting sensation. To treat that nausea and vomiting sensation, we are administering the diphenhydramines, are the first generation antihistamines, and to reduce the cough and as well as for the allergic reactions. Okay, these are the indications of diphenhydramine. And next we'll see the indications of the chlorpheniramine. Chlorpheniramine, it is administered for the allergic reactions and rhinitis and urticaria. Urticaria and pruritus, these are the these two are the skin conditions, are the skin diseases. Okay, means here the patient may have the rashes and itching, or the itching of the skin. Okay, to treat all these conditions, we should administer the chlorpheniramines. And next is promethazine. Promethazine, it is administered for the treatment of the allergic reactions, motion sickness as well as for the sedation also, and to treat the nausea and vomiting, and to treat the insomnia, that is a lack of sleep. Okay, these are the classifications and indications of the first generation antihistamines. Next we'll see about the first generation antihistamines. Okay, first generation antihistamines, example for that first generation antihistamines are diphenhydramine, chlorpheniramine and promethazine. Here we'll see about the drugs and dosage, forms and strength, and adult dose and pediatric dose. Here the drug, that is diphenhydramine. Diphenhydramine, it is available in the form of tablet, capsule and syrup. The tablet form, here it includes the 25 mg and 50 mg, and in a capsule form it is available 25 mg, and in a syrup 12.5 mg per 5 ml or 12.5 mg per 10 ml. Andre 5 ml bottle it includes the 12.5 mg, and also the 10 ml syrup bottle it includes the 12.5 mg. And the adult dose, here the adult dose of diphenhydramine is orally, it is administered 25 to 50 mg per 4 to 6 hours. Andre 4 to 6 hours alli only we can administer, sorry, in the duration of 4 to 6 hours. 4 to 6 hours gap alli idbidbeku 25 to 50 mg. And in injection form, it may be in the IMR and IV, you can administer only 10 to 50 mg. Okay, and in a pediatric dose, orally it is administered 1.25 mg per kg every 4 to 6 hours, and QID. Okay, 4 times a day. And next IMR IV, it is administered 1 mg per kg body weight. And next we'll see about the chlorpheniramine. Chlorpheniramine, it is available in the form of tablet and in a syrup. Here the tablet, it contains the 4 mg and it is available as 4 mg and 8 mg tablets. Okay, 4 tablets in 4 mg to 8 mg. Next the syrups, it is available 2 mg for 5 ml, 4 mg and 8 mg for 5 ml. Okay, and the syrup, it is available in 3 forms: 2 mg, 4 mg and 5 mg syrup bottles. Next for adult dose, it is orally 4 to 8 mg per 4 to 6 hours, and pediatric orally it is administered 0.1 to 0.5 mg per kg body weight in the duration of 4 to 6 hours, and IMR IV, it is administered 0.05 to 0.5 mg per kg body weight. And next next drug is promethazine. Promethazine, it is at the dosage and forms is, it is available in the form of tablet as well as the syrup. The tablet is 12.5 mg and 25 mg and 50 mg. It is available in the 3 forms of the drug. It is available in the 3 strengths, that is in 12.5 mg, 25 mg and 50 mg. And next the syrup, it is available in 3 forms, that is in 5 ml. 5 ml syrup contains 6.25 mg, 25 mg and 50 mg. And next the 6.25 mg syrup, it is present in the 10 ml bottles. And next the dose for the adult is oral, it is administered 12.5 mg to 50 mg every 4 to 6 hours. And pediatric dose oral 0.25 to 1 mg per kg body weight in the duration of 4 to 6 hours. And IMR IV injections, it is available 0.25 to 1 mg per kg body weight. Okay, this is the drugs dosage and forms and the drugs administered, the dose administered for the adults as well as the pediatrics. Okay, next we'll see the contraindications of the first generation antihistamines. Here the contraindications are hypersensitivity reactions, means the individual who are having the allergic reaction towards that particular drug we should not administer. And next, severe liver diseases. Why we should not administer these drugs in the severe liver diseases? Because the metabolism is usually occurs in the liver. Metabolism is usually occurs in the liver. If we administer these drugs in the prolonged period of time or during the severe liver diseases, there is no metabolism. If there is no metabolism, the drug is going to settle in the liver, means it may causes the liver toxicity or the drug toxicity. Okay, and next, in the severe asthmatic conditions we should not administer. Next we'll see the pharmacokinetics. Here the pharmacokinetics of the first generation antihistamines are, these are well absorbed after oral administration. Okay, these drugs are well absorbed after oral administration and widely distributed including into the CNS. Okay, pharmacokinetic, it includes the 4 step, that is an absorption, distribution and metabolism and excretion. Okay, here the absorption, it is occurs through the oral administrations. And next, widely distributed including to the CNS. Here it is going to distribute to the CNS and it leads to the extensively metabolize in the liver. It is going to metabolize in the liver and it excretion through the urine or the kidneys. The excretion is mainly occurs in the kidneys. From the kidneys, the urinations will occur. So it is the drug is going to excrete through the urine. Okay, this is the pharmacokinetic of the first generation antihistamines. And next we'll see about the side effects. Okay, after the administration, the patient may feel the dry mouth. Okay, dry mouth, drowsiness, constipation, dizziness or lightheadedness, and impaired coordinations, impaired body coordination, and increase heart rate and decrease the blood pressure. Sometimes the patient may go for the hypotension. Okay, that is a decreased blood pressure. Okay, this is the in detail explanation about the first generation antihistamines. Next we'll see about the second generation antihistamines. Here the drugs comes under the second generation antihistamines are cetirizine, loratadine, fexofenamide and deslorelin. Okay, deslorelin. And next, here we'll see about the drugs and adult dose and children for the 6 to 11 years and 2 to 5 years children, administrations of the medications and the routes. Here the cetirizine is administered through the adult is 10 mg tablet per day. Okay, per day means once in a day. Okay, daily one time matra administration ಮಾಡಬೇಕು. Next for the children 6 to 11 years. 6 to 11 years children it is available in the form of tablet as well as the syrup. Syrup is administered 5 mg per day OD. Okay, once in a day. And next, for 2 to 5 years children, it is administered 2.5 mg syrup per day once in a day. Okay, once in a day. And next, the 5 mg. And next is loratadine. Loratadine is administered 10 mg once in a day for the adults, and for the children 6 to 11 years is 10 mg. Next we'll see about the second generation antihistamines. The drugs are the examples for the second generation antihistamines are cetirizine, loratadine, fexofenamide and deslorelin. And cetirizine for the adults, it is administered 10 mg tablet per day, that is once in a day, one time. Okay, and next for the children 6 to 11 years, it is available in the form of syrup. So it is administered 5 mg syrup once in a day, and 2 to 5 years children 2.5 mg syrup per day. And next is loratadine. It is administered for the adults is 10 mg once in a day, and next for the children 10 mg tablet are in a syrup. Okay, syrups ಆದರೂ ಕೊಡಬಹುದು ಇಲ್ಲ tablets, that is only for the 10 mg once in a day. And For the 2 to 5 years children, 5 mg syrup per day. And next is foxofenamide. Foxopanadine, it is administered 60 mg 2 times in a day and 80 mg once in a day. And for the children 6 to 11 years is 30 mg tablet once in a day, 2 times in a day. Okay, for children 30 mg tablet on daily 2 times, twice in a day and 2 times in a day ಕೊಡಬಹುದು. And for the 2 to 5 years children, it is administered 15 mg BD, means 2 times in a day, or it is available in the form of syrup, and 30 mg syrup OD once in a day. And next, desloratadine, it is administered 5 mg tablet for adults, that is in a once in a day. And for the 6 to 11 years children, 2.5 mg tablet, it is once in a day. And for the 2 to 5 years children, it is administered 1.25 mg syrup once in a day. Okay, these are the drug administration for the adults and the children 6 to 11 years and then 2 to 5 years. So next we'll see the indications of this second generation antihistamines are these drugs are used for the treatment of allergic rhinitis, sneezing, running nose and an itching, and watery eyes and itching of the throat and a palate. ಗಂಟ್ಲ ಕಿರಿಕಿರಿ ಏನಿರುತ್ತೆ ಅವಾಗೆಲ್ಲ ಸೆಕೆಂಡ್ ಜನರೇಷನ್ antihistamines ಅನ್ನು ಯೂಸ್ ಮಾಡಬಹುದು. ಓಕೆ, sneezing, running nose, itching and watery eyes and itching of the throat and palate, these are more common in allergic rhinitis as well as the sinusitis. And next we'll see the side effects. Side effect of these drugs are dry mouth, headache, dizziness, urinary retention. If there is no proper excretion, the patient may feel the urinary retention. And cardiac effect. The cardiac effect are sometimes the person may having the increased heart rate and then decrease blood pressure and increase appetite. Increase appetite is nothing but a feeling of hungriness. Increase the level of hungriness and the patient may feel the restlessness. Okay, next we'll see the pharmacokinetic. Pharmacokinetic, it already you know about the pharmacokinetic, that is an absorption, distribution, metabolism and excretion. The absorption it occurs through the mouth, and absorption it occurs through the mouth, and distribution it occurs through the up to the CNS, and metabolism it occurs in the liver, and excretion it occurs through the urine in the kidneys. Next we'll see about the third generation antihistamines. Here the drugs for the third generation antihistamines are levocetirizine and bilastine. And the dose the dose for the adults are 5 mg tablet once in a day, and for the 6 to 11 years children it is administered 2.5 mg tablet per day, and 2 to 5 years children 1.2 mg per OD, that means once in a day. And bilastine, it is used for the adult doses 20 mg tablet once in a day, and 6 to 11 years and 2 to 5 years children, for them these drugs are not recommended because these drugs are not safe for those children. And here the indications are same like the second generation antihistamines. Those are indications those are urticaria, sneezing, rhinitis and allergic sinusitis. These are more common for all the generation antihistamines, and the side effects as an adverse effect are more common like the first and second generation antihistamines.